name.
Hello, my name is Terence Neff. I'm one of the pediatricians here at Coeur Pediatrics. We welcome you to our educational video program that we have available for our families through the office. Today's topic will be insect stings. Now, first of all, I need to remind you that every child is unique, and these are educational videos. They are not meant to make diagnosis nor to recommend specific treatments for your child. If you have questions about your specific child, please contact your own personal care providers. Now, let's talk about insect bites, specifically bee stings. Now, when we talk about bees in the Northwest, we're really talking about bees, honeybees, as well as wasps and yellow jackets. Now, all of these are stinging insects, and they sting when they get upset, or if they get bothered, or sometimes just if they want to sting you, it seems like. When they sting, they will inject a venom into the skin. And the initial response that you have to a sting has to do with the initial pain from the sting itself, and as well as how your body responds to the venom that's been injected into your body. Now, the response is dependent upon how much of the venom is injected into your body, as well as your own sensitivities. There are basically three types of responses. One is a local response. And by local response, you're talking about the area right around the injection site itself. And this can include the pain, as well as redness and swelling. It is not unusual to have up to 6 inches of swelling right around an insect bite, such as a bee or wasp. The swelling can progress to include whole extremities. And the difference between a localized reaction and a more overall body reaction is that the reaction crosses a major joint, such as your shoulder, your knee, or your hip. A localized reaction may therefore include your arm, and your whole arm could be swollen, or your leg from your knee down could be swollen. This is still a local reaction. The second type of reaction is a more systemic reaction, and this is one that involves the whole body. This could be a reaction such as hives, or sometimes nausea and vomiting. There's a third type of reaction that is called an anaphylactic reaction. And this can be a life-threatening event, which is a reaction that occurs when the total body systems are involved. It may include difficulty breathing, swelling of the neck. It may include being very faint or faint-headed, dizziness, passing out. It may include heart palpitations and can lead to death. This is the type of reaction that we all think about when we think about a bad reaction to insect bites. Now, when you have an insect bite, what can you do about it? And there are some immediate things that we can do to help prevent reactions from occurring or to limit the reactions that occur. Number one, you realize it is because of a stinger went into the skin and injected venom. Bees, specifically, leave the stinger in the skin attached to the venom sac or a sac of the poison. Most yellow jackets and wasps do not leave their stinger with you, and they can sting therefore multiple times, but they inject each time they sting. If you find a stinger left in the body, it's very important to get this stinger out. And it can be done from a couple of ways. One way is to gently scrape it out with a hard-edged object. It can be a butter knife, or you can use a credit card and scrape the stinger out. You can then also grab it, but be very careful if you grab to pull the stinger out, because if the venom sac is still attached, you do not want to squeeze more venom into the body. The second thing you can do when you have a sting is that you can then put a poultice on this. And a poultice is a dry powder that you then make into a type of a paste that put on this. My grandmother was great at using poultice on these things, and she used for insect bites, she liked to have a baking soda poultice. So she would take some baking soda, put it in a little bowl, mix it with water to make a paste, and put it over the top of insect bites. You can also use something like meat tenderizer, Adolph's meat tenderizer. And meat tenderizer works because it breaks down proteins, and the venoms are made out of proteins. And to make a poultice or a paste of a meat tenderizer on the skin and cover it up with a bandage or a cloth can sometimes degrade or break down the proteins, the poisons, so it doesn't cause as much problems. Once you are stung, then you may have a reaction, you may not. Sometimes, if you have a reaction, a local reaction or a more systemic reaction, you can avoid this or limit it by using a medication such as Benadryl, which is an antihistamine. And Benadryl is the mainstay. If you would like to have the dosage for Benadryl for your children, please visit us on the website, and it is attached to a newsletter concerning bees stings. But the appropriate dose of Benadryl can be given every 4 to 6 hours, and because at times it will limit the spread of the reaction. If you notice that you are having a localized reaction with some swelling, it is very important to use something like Benadryl. Benadryl is very important if you're starting to have hives or swelling because it can limit that reaction, but you may need to give Benadryl for 2 or 3 days. It is interesting with bee stings that sometimes they look worse even 2 days after the sting itself, and so it's not uncommon for people to come to my office 2 days after a bee sting and say, oh my gosh, it is more red, it is more swollen. And indeed, that is expected. That is part of the process that the body has of making the venom completely go away, and so don't be surprised about that. If you have a child who has had more systemic reactions, meaning hives over the whole body or some vomiting in the past, it is important to give Benadryl as quickly as you can after you have been stung by a bee. If your child has had a history of an anaphylactic reaction, most of these children have been identified through their physician or through the emergency room as a result of this event that occurred, and they have been given what's called an EpiPen. An EpiPen is an injectable form of epinephrine that helps stop the intensity of the allergic reaction that's occurring within the body. Use of the EpiPen is very important if you have a past history of bad reaction. It should be given quickly, as soon as you can, as soon as you realize you're in danger of having a bad reaction. Now you must remember that if you are going to be using your EpiPen, it should be used as directed, and you need to realize that the epinephrine in this medication does not last for a long period of time. It will slow down the reaction for somewhere around 10 minutes to 30 minutes. If you are using the EpiPen, and if you need to use an EpiPen, it is important to also give Benadryl and also to contact your healthcare professional or take the child in the emergency room, because you do not want to have a situation in which the epinephrine, its effectiveness runs out and you have not taken appropriate steps to prevent additional issues or additional reactions with your child. Thank you very much for viewing this discussion about bee stings. Coeur Pediatrics is available to see patients on a daily basis. We have same-day and next-day visits available. We are accepting new patients at all times, and we accept almost all insurances, including Medicaid and TRICARE. If you'd like to make an appointment, please contact our office. It's 208-667-0585, or you can visit us on our website, cdapeds.com. Thank you very much for visiting with us today.